In Texas, we're on the front lines of the fentanyl crisis.
If I have to stand on the corner of 42nd and Grandview with a megaphone, I'm going to do that. We've got to get the word out that, look, you're going to pay the price.
There's enough fentanyl overdoses nationwide that it actually comes down to and equals one Midland resident dying every single week.
These kids are dealing with so much more than she and I did, and you and I did.
It's a very heart-wrenching, it's unimaginable to lose a child, especially to something like this.
I know nothing is more important than protecting our kids. It only takes 2 milligrams of fentanyl to kill a grown adult.
But every Texan has a role to play when it comes to ending the fentanyl crisis.
We'd rather arrest their kid than put them in a bag.
Good evening, and thank you for joining us. I'm Mike Mahoney, and tonight we are focusing on the dangers of one of the deadliest drugs plaguing the Permian Basin, fentanyl. And that's because today is Fentanyl Awareness Day.
Good evening, I'm Madeline Bierster. Tonight in part 3 of this special report, we're discussing the dangers surrounding fentanyl and hearing testimony from a local family still suffering from losing their loved one to this deadly drug. Now, with legislation now in place to prosecute fentanyl dealers, Jackson's family is hoping something can be done even in his case.
I didn't even know what fentanyl was till after Jackson passed away. Even though so many people were dying and it was everywhere, I just didn't pay attention. I didn't even know what it was. I didn't know it existed.
Knowing what they know now and the heartbreak the Warnick family continues to go through, they don't wish this pain upon anyone else. They've taken steps to make sure more families don't experience the same fate.
February 28th, we went to City Council in front of all of them, and I held up Jackson's picture and I said, now, I'm a grieving mother, we're a grieving family. You tell us what we need to do in this community. And they were very supportive. Afterwards, the mayor prayed with us and expressed his condolences, and every one of them did. And some of them were teary-eyed when I was speaking, and they know it's a problem.
Court records show that the suspect, believed to have sold Jackson that pill, was implicated in several fentanyl-related poisonings.
His coworker was convicted of selling fentanyl pills. He wasn't included in that case, but I mean, we drew conclusions that that's where he got it. It was very shortly afterwards that she was caught with a very large amount of fentanyl. She went to jail or prison and became eligible 2 weeks after she got there. She will be out on parole in 11 months after she got to prison on a 5-year sentence. That's disheartening.
On September 1st of 2023, Governor Abbott signed into law legislation that gives prosecutors the authority to levy a murder charge on anyone caught selling or supplying someone with fentanyl if that person died of complications related to the drug.
Make an example. We've got to get the word out that, look, you want to distribute something that's going to kill somebody, you're going to pay the price, and you should pay the price.
Still, no one's been charged in connection with Jackson's death.
We went to visit her. After she was put in jail, we went to visit her. And I had to keep my cool. And we wore our shirts, and she would not make eye contact with us. She would not look at us. And I ended with, I'm going to pray for you. And I took the high road.
She said, I don't understand why you're here. And she said, I just want you to see my son's face.
We had our shirts on, we had our buttons, and she would give us the side eye, and she knew.
Jackson's family says they won't give up.
I'm not going to stop. I told Cheyenne, if I have to stand on the corner of 42nd and Grandview with a megaphone, a bullhorn, I'm going to do that.
Her message to others:
stop and think about who would miss you. Don't be a statistic. Don't trust anybody. Don't trust your friends, your best friend. Like I said, they don't know where they got it. That person doesn't know where they got it. Talk to somebody if you're feeling low and you're feeling down.
Get help now, because that one time that you do it again could be your last time.
I don't want to see another family sitting here discussing their loved one.
Jackson and the countless others taken by this drug will not be forgotten and will continue to tell their stories and share awareness on the dangers of this drug. Again, it only takes one.
That's right, and local lawmakers are also working to raise awareness with new legislation.
Tragically, over 100,000 young Americans were killed by drug overdoses last year, with fentanyl driving a surge in those deaths. Social media platforms have become hotspots for drug trading, with parents often having no idea their child has obtained the substances. I introduced legislation to designate social media platforms as protected zones for children, like schools and parks. This gives law enforcement the ability to crack down on criminals who are reaching out to children via social media to sell and distribute drugs.
Last year, I passed a new law to increase penalties for fentanyl distribution and allow fentanyl dealers to be charged with murder. In Texas, we're treating fentanyl like poison because that's exactly what it is. Fentanyl is lethal in incredibly small amounts, as little as 2 milligrams, meaning it needs to be classified and prosecuted unlike any other drug.
And it's not just lawmakers that are speaking out against this epidemic. Local law enforcement also has something to say.
Now, we sat down with local officers to hear their perspective on this problem in West Texas.
In the past couple of years, our fentanyl seizures have increased. I don't know what they are this year so far, but I know about 2 weeks ago we did seize about 1,100 fentanyl tablets, fentanyl-laced tablets, and it's continuous. You know, at the fair, last fair, one of our deputies did contact a 15-year-old individual because he noticed him vaping. Upon further investigation, this 15-year-old was found with a handgun and a pretty good quantity of fentanyl-laced pills, 15 years old.
Even small amounts of fentanyl can be deadly. If you're providing fentanyl, you are a potential murderer and you will be treated as one.
If anybody out there believes or thinks that their child may be involved in some kind of fentanyl operation, fentanyl use, or anything of that nature, we encourage them to call us, call the PD. We don't want to have to. We'd rather arrest their kid than put them in a bag.
And in an effort to prevent more fentanyl-related deaths, there is some life-saving advice that health officials are sharing with us tonight.
Yeah, this comes now with a call for more fentanyl education. Signs of an opioid overdose include slow or no breathing, pale, cold, or blue skin, loss of consciousness, and choking. Local healthcare professionals say there are some things you need to watch out for, too.
Because it's so potent, it's happening more so very quickly. So the things to watch out for, like they might, I always kind of describe it as in the movies, you know, when you see somebody take a hit of heroin and they kind of just fall back and relax. That's kind of how it happens in an overdose as well. You know, they get real relaxed, they become unresponsive, they become cool, clammy, and pale. Their breathing will slow down. It's very important that you get help there. Call 911 and get them help as soon as possible.
In worst case scenarios like an overdose, naloxone is an effective way to reverse the effects of a deadly opioid like fentanyl. Typically, naloxone will be administered in the event of an overdose by medical professionals, but the life-saving drug is also available to purchase and carry with you in our state should, of course, an incident happen.
That's right, and naloxone can be found in pharmacies throughout Texas like Walgreens and CVS, as well as some other markets like Kroger and Walmart. And there are also websites where you can purchase naloxone and have it shipped to you, such as naloxoneexchange.com and naloxonetexas.com. And the Permian Basin Regional Council on Alcohol and Drug Abuse also offers classes and presentations on how to administer this life-saving medication. And there are also local resources that are here to help, like the Springboard Center.
The executive director there tells us a bit about how the center is working to help lend a hand in our community.
We are the highest certified. We are an absolutely fantastic facility. We approach it from all angles. More than half of our staff are in recovery, so they've been there themselves and they get it, including myself. You know, I work on the business side of things, but I have a heart and a passion for this, just like the rest of our staff do. We devote our lives to this. This isn't just a place to come to work and to do a job. It's to make an impact in our community, to really change things and make things different. We've got incredible chefs, you know, quite literally. You know, I eat lunch here every single day. It's one of my favorite meals. Don't tell my wife I said that. You know, we've got you know, beautiful gym and half basketball court, and we've got volleyball, but we also have incredible counselors. And when a client comes in, they're assigned their own counselor. They're also assigned their own recovery advocate. The recovery advocate sits down with them one-on-one and takes them through the 12-step process. And they're counselors who they sit down with to deep dive on that traumatic experience, whatever has gone on earlier in their lives, which may have led to this path.
The Springboard Center is just one of the many places here locally where you can reach out for help.
That's right, and there is now a national hotline created for family members of people with alcohol abuse and drug abuse problems. And that number, well, you can see it right there on your screen. It's 1-800-662-HELP. And the help that you'll get on that hotline is confidential, it's free, and it's available 24 hours a day, 365 days a year in both English and Spanish. This service provides referrals to local treatment facilities, support groups, and community-based organizations.
If you need immediate help, you can call or text 988 rather. There you can chat with professionals for yourself, or if you're worried about a loved one who may need crisis support. 988 serves as a universal entry point. So no matter where you live in the U.S., you can reach a trained crisis counselor who can help 24/7.